Hello, my name is Marianne Borer from HIMSS, and welcome to today's webinar. Thank you for taking time to be here today. We have an exciting program for you, but before we get started, I would like to highlight a few things so you'll know how to participate in today's event. At the bottom of your screen are multiple application engagement tools you can use. All of these engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you need technical support during today's event, click the question mark icon in the navigation menu at the bottom of your screen, where you'll find answers to frequently asked questions, or you can type your questions in the Q&A widget to the right of the media player. You can use that same box to submit questions for our speakers at any time. And if we don't get to your question today, we'll follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. If you miss anything, don't worry. You'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. So now, let's get started with today's program. Accelerating Innovation, Amplifying Impact. Learn how clinical communication complements HCA Healthcare's digital ecosystem. Sponsored by Mobile Heartbeat. Our moderator today, Dr. Annabaker Garber, Chief Clinical Officer at Mobile Heartbeat. And with that, I'll hand off Dr. Garber to begin our presentation.
Thank you so much. Welcome, everybody. We're so happy that you've tuned in today. My name is Annabaker Garber, and I'm the Chief Clinical Officer at Mobile Heartbeat, and I will be your moderator for today's presentation. In today's webinar, we'll cover the following topics: Mobile Heartbeat at HCA Healthcare, how they effectively leverage the CC&C platform, how they use it to accelerate innovations, and the importance of resiliency and always-on communication. And we'll follow this up with a brief question and answer session. Both of our speakers today, Chris George and Alex Horn, are representing HCA Healthcare. First, I'd like to introduce Chris George. She's the manager of nursing informatics. Chris is a highly experienced leader in the healthcare industry with over 30 years of expertise in clinical and nursing informatics and information technology. In her current role at HCA Healthcare, she oversees HCA Healthcare's mobile platform, integrations with key systems, and the development of innovative products. Our next speaker is Alex Horn. Alex is the Senior Manager of Nursing Technologies in their ITG group. Alex started her career at HCA Healthcare in 2018 and has progressively taken on leadership roles with the Information Technology Group over the last few years. Alex's current position oversees clinical communications team within nursing technologies. So she and Chris work very closely together to make sure that all these communication tools are working seamlessly. The portfolio includes oversight of the iMobile devices, which is HCA's branding of their mobility platform, the Mobile Heartbeat applications, language service products, and the nurse call system. And finally, I am Dr. Annabaker Garber. In addition to being the Chief Clinical Officer at Mobile Heartbeat, I'm the moderator for today's event. I have more than 20 years of experience in healthcare, and my day-to-day efforts at Mobile Heartbeat focus on operations, strategic planning, implementation, and delivery, as well as thought leadership across the industry. I'm formerly the CNIO at HCA Healthcare from 2016 to 2022, and some of those accomplishments included being one of the leaders that oversaw the enterprise-wide implementation of Mobile Heartbeat, as well as a lot of other applications, such as the nurse call upgrade and many mobile applications that we put on the platform. So to set the stage, we're going to talk first about the benefits of a clinical communication and communication platform. Can you, Chris and Alex, describe how clinical communication fits into the broader vision of HCA Healthcare's digital platform? Chris, can we start with you?
Absolutely. At HCA Healthcare, our mission centers on the care and improvement of human life. So robust and comprehensive clinical communication strategies are a key component of delivering on that mission for both our clinicians and the patients who trust us for their care. And one of the ways that we fulfill this mission is through anchor platforms that connect the hospitals across our health system. The electronic health record, which is our system of documentation, and our communication platform, which is our system of action. Banyan is the communication platform that keeps our clinicians seamlessly connected. It makes it easy to find colleagues and stay informed throughout timely alerts and notifications, giving us confidence that everyone is aligned and engaged. Think of it as the cultural glue that makes every interaction feel consistent and helps solve the last mile care challenge by quickly connecting you to the right person with the right patient context. Alex, would you like to add to that?
Yeah, so I'd like to highlight a few example benefits of having a consolidated CNC solution. So first, we really like to reduce fragmentation. So instead of our clinicians having to juggle multiple apps and systems at one time, we like to make sure everything flows through one single platform. We like to drive efficiency by consolidating clinical workflows, which not only reduces administrative burden, but really speeds up that collaboration and information sharing. And then lastly, integrating other systems is a real key part of a CNC solution. By integrating these different systems and products such as the EHR, monitoring, alerting, scheduling, our care teams really have the right context and information at the right time so they can make the very best decisions for our patients.
So it really sounds like your platform is kind of like a one-stop shop. All the information that your clinicians need is in the palm of their hand. How do you think that your clinicians particularly see the efficiency of this? How does it reduce their burden?
So at HCA, we really have a robust and and secure mobile ecosystem, which you mentioned we call iMobile. This encompasses over 105,000 iPhones, as well as the anchor platform, Banyan. We really, just to give some perspective, this is extremely heavily utilized on an annual basis. Our care teams are sending millions of texts, phone calls, broadcasts within the platform, and we actually have over 30 integrated apps. And the solution is deployed across all HCA healthcare facilities across the enterprise, which really creates a standardized communication experience for our clinicians.
So, what I infer from here is you're not just giving this to doctors and nurses. So what kind of roles get the mobile platform?
So it is not just our bedside nurses or the providers that use our platform. It goes all the way down to our patient care techs, our EVS folks, our transportation people, as well as our food and nutrition services, our security team. So it really brings the entire facility together.
And are you using shared devices or bring your own devices or both?
We are actually using both. So for our end users, the main staff, they come in at the start of the day and they will grab a phone from their unit and log in. But for those folks that are needed for either on call or like our leadership, the unit directors, our CNOs, CMOs, all the way up, they use their HCA dedicated device that has a cellular plan. So that way they are able to be reached at any time should the need arise.
So you're supporting more than just clinical workflows. And by that, I mean clinicians talking to each other. It sounds like you're also really supporting operational workflows like throughput or administrators being able to talk with unit level staff or security issues. There's all kinds of workflows that are supported, not just clinician to clinician.
And that is correct. So there are things like mass casualties where we can send out a large communication that a mass casualty event has happened and, get that all hands on deck and folks to respond to our ED.
Okay, so you're going right where I was going to go next, Chris, which was if you could give us an example of how this platform directly improved a clinical scenario for you.
Absolutely. And that's exactly where I was hoping we were going to go next. And so one of those examples is the incident that happened at Sunrise Hospital in Las Vegas. And so in response to an emergency event, hundreds of patients flooded that emergency room. As a component of emergency preparedness planning, Sunrise staff used the mobile heartbeat platform to broadcast messages for those mass updates, text messages to confirm the readiness, group chats for care teams, and phone calls for critical coordination. Every part of the mobile heartbeat platform was activated that day. One on a more practice level, I used to work at a multi-campus facility with two hospitals under that same license, or what we call co-ID. And so we could communicate seamlessly and culturally like we were one care team in the same place. Even though we were separated by 8 miles, you wouldn't know it because of how easily we could communicate with one another.
So that's a really good example of the cultural glue, if you will, that you were talking about
Absolutely.
earlier. So it sounds to me that HCA also considers clinical communication more than just sending a text message to somebody, that other components are important.
Yes. And so some of the things in some of those integrations, we are able to identify key things and send alerts directly to the primary care team or even just the primary nurse. So that way they understand and are getting that notification. And I'll let Alex dive a little more into some of the technical pieces of that.
Yeah, and I think while we're specifically talking about some of these benefits, I'd love to share some initial studies after we rolled this platform out that really speak to that collaboration and how it truly impacts the coordination within the hospitals and our clinical care. So some initial studies after we first implemented showed our ED to floor admissions on average were 32 minutes faster by using the communication tool.
Wow.
Our broadcast messaging actually allows us to save roughly 33 hours a day on average by these folks not having to call resources individually, text them individually. They can really share large mass scale communications, as Chris mentioned, on a broad scale across the facility. And then lastly, our nurse call responses were 40% faster. And just having this in my portfolio and knowing that app very well, it really directly impacts patient care and patient safety.
So you're implying, Alex, that the nurse call system is integrated with this platform as well. It's one of the integrations.
It is. It's extremely widely used. There's a lot of alerts that go out, and the response times to not only patient requests, but patient safety concerns. I feel like we've really made great strides with this workflow for our nurses.
So you're also including nurse call as a form of communication.
Yes.
So you've got texting, that's one form. You've got phone calling, that's another form. You've got broadcast messaging, that's another form. You've got nurse call, you've got group chats. And how do the users find the person or group of people that they need to get a hold of?
So we have a really comprehensive directory built out within the platform. We also use things like dynamic roles for some of our key roles within the facility where you might have shift change. I don't have to go looking for those. They're automatically filled from the assignments as they're made when they come on shift for the day. So it's a really easy way to know who to contact at the right time and have that all at your fingertips. And I think you said it best, where there's so many different signals and ways to communicate, but we're funneling all of that through this platform instead of multiple methods of communication. It's really seamless for the clinicians.
That's fantastic. So in addition to everybody being connected through this platform, let's talk a little bit more about the integration. So we alluded to that a little bit with the nurse call system. So how does this interoperability, make communication meaningful at HCA, and what does this really look like in practice?
So on the clinical side of that, we have this secure app. So we know everything stays within that application. It's HIPAA compliant. And that app, it launches a mobile version to a mobile version of our EHR. So if you need to dive deeper into the patient chart, you can do that right from Banyan. And what I mean by that is you can pull up the patient. We have a link right from the patient's record that will launch us over to our EHR and pull up anything that we need to see on that patient. So we can view that chart without having to leave Banyan and open another application. It does it for us. It also securely pulls in alerts from other applications. So everything is in one place. And that's what we were referring to as that anchor app earlier. Those alerts keep our nurses in the loop on what's happening operationally. And it's not just about alerts. Inside Banyan, there's those quick links to short training videos. We can put survey forms that we want the nurses to answer, or not just nurses, but any of our end users. And any reference materials will right there at their fingertips. So if we're introducing something new, we can actually, put that education right there. It's right there at their fingertips. They don't have to go searching for it. And then I'll let Alex talk on the technical side of things.
Yeah, so in addition to our clinical integrations, one of the ways that we manage over 200,000 users across the system in this platform is through really strong and secure integration with our technical systems. I'm sure everyone knows technology is advancing at a rapid pace. With that comes security concerns, onboarding challenges, fragmented communication. And I feel like with this platform, we're able to connect to our security tools, our access tools, and create these key technical integrations, which helps us stay safe, secure, and resilient on the back end.
So from the clinical facing side, you've got key applications integrated like your EHR and like your nurse call system and your intranet for serving up information and change management. And on the technical side, it sounds like you're able to integrate with your provisioning, it sounds like, I'm going to infer, and your directory of who's working where. And so you can manage the users on the backside. What about single sign-on? How are you guys doing with integrating in those systems?
So we're really working towards a robust single sign-on experience for the mobile platform overall. I think a way that we really do something very sophisticated today is with the link and launch capabilities between apps. Our clinicians have multiple apps on the phone that they need to access, but since we view Banyan as an anchor app, we actually create link and launch capability where if I'm in the patient record and I need to move to the EHR app, I can easily do that and actually don't have to log in. I go right to the other system. The information's right at my fingertips, and then I can launch back into Banyan. So we really reduce the amount of manual sign-in that our clinicians have to do on the mobile phones.
So this sounds like a really big job. You have 200,000 users and at least 33 integrations. How do you, make sure that you've got this well governed and that you've got it reliable and that everybody's having the same experience?
That's a great question. So again, Banyan, that is our anchor app. So we use that as that starting point. And it's the application that communicates with our other applications to receive that relevant information. The EHR, again, is one of those that's central for documentation, and the ability to be able to launch from Banyan into the EHR is a huge win for our users. So Banyan is what we call that system of action that allows us to be nimble. And with Banyan, you can easily connect to the EHR via the inter-app launch point that Alex was just talking about. And that creates the seamless experience and a consistent experience. If a user floats between hospitals, they know exactly how to leverage the system, no matter what location they're at. For example, if you go from facility to facility, there's a strong sense of standardization. So when you receive an alert, you don't have to question what that tone means. You already know. Governance is a key when impacting a clinical communication platform enterprise-wide. At HCA Healthcare, we have governance at the user and facility levels, and similarly, we have governance at the division level. So standardizing the builds, the roles, the tones and alerts, added application layout on the home screen of devices all sets that standard for that seamless experience. We also have a group that we get regular feedback from, and that consists of our users at the bedside. And we use their feedback to kind of roadmap where we're going to go with our enhancements. So we are taking their voice into consideration, and it's not just us creating something. And implementation and training are also standardized. So we come up with the materials, and it then gets pushed out to those end users. And by that standardization, they also know where to find the education. It's all in one centralized location. And then we also ensure that there's a consistent experience for our updates and changes by having those regularly scheduled releases based on those enhancements and that user feedback on prioritizing what goes into each release. That's part of that software development lifecycle, which that's a whole nother discussion. We can not go there.
Well, so it sounds like you've got a very repeatable process across your 190 hospitals, and you've got a very predictable process for your end users. Do they see this as a feature or a bug? Do they like the fact that it's a predictable and standard, or do they feel oppressed by that?
It's overwhelmingly a positive, because it doesn't add to any confusion for those that do go from facility to facility. They can confidently go into a facility and say, hey, I know what that means. They don't have to ask somebody, what does this tone mean again? So it eliminates that burden of having differences and not being standard.
So Alex, when I look at this representative sample of the various integrations that you're managing, I see that you have 3, maybe 4 EHRs, and I see that you have several pieces of middleware, and I see that you've got several monitoring systems. So how does the Banyan platform make this variety of things feel seamless?
I think that's really key for us is, making sure that regardless of the EHR, the continuum of systems that a clinician might encounter from one facility to the next, it needs to be consistent. As Chris mentioned, if I'm a traveler, I don't want to have to know what the different alerts mean or tones or have a completely different workflow just because my facility might have one EHR versus the other. I think with Banyan, the API framework is so extensive. We can really take these different use cases and build the integration within the app and make that really seamless for them, where maybe they don't even realize that they have a different nurse call system at one facility than the one that they worked at yesterday. And same thing with the EHR. So we really try to be very consistent in the workflows that we build in from an integrated standpoint.
So you guys sound like you've done a fantastic job of making it pretty easy for the end user. And it's become a really key component of how you how your hospitals do their day-to-day work. That implies that the system has to be really resilient and it has to be working all the time. Can you, Alex, describe what that means to you as somebody who's in the middle of managing it?
Yeah, so when Chris mentioned HCA Healthcare is committed to the care of our patients, and we're a patient-first organization, from an IT perspective, what that really means to me is making sure we keep critical systems like Banyan up and running 24/7 to allow our clinicians to take care of their patients round the clock. So with Banyan, it's a cloud-native microservices-based platform that's built in Microsoft Azure. So this really allows for not only lightweight management for our IT resources on my team and our engineering teams, but the architecture is really foundationally built for resiliency, no downtime, and always on communication, which is really essential, as we all know, for healthcare environments where there's little to no room for error. In addition to some of the cloud-based efficiencies that we gain with Banyan, there's actually some new features built into the platform around resiliency. One of those is called Banyan Continuity Services, which really helps us ensure that the communication and the functionality persists even during disruptions like things to our network or other unforeseen events. So, resiliency is key here, and I feel like we've gone leaps and bounds beyond what we might have been in the past with Banyan.
Oh, sounds fantastic. So you alluded to the fact that Banyan's a modern architecture, and that implies that you're going to be using it for new uses going forward, or there are going to be new features that you add. So can you talk a little bit about how you foresee Banyan helping you to communicate and coordinate with new technologies that you're adding?
Yeah, I would love to take that one. So we really enjoy having a strong partnership with Mobile Heartbeat. We work very well together. It's a collaborative effort. The potential of virtual care, our telehealth providers, centralized monitoring, virtual nursing, they all seamlessly integrate into our on-site workflows. And using Banyan as, again, that anchor platform. And it means that we are not bound by geography. So our offsite care team members can be included as if they were physically present. That goes back to my example of working at a multi-campus facility. It felt like we were all right there together. And these offsite care team members can take responsibility of admin related tasks, such as that support intake, patient education, and discharge related tasks. This way, the on-site care team can focus more on the delivery of patient care, giving that time back to them to be at the bedside. Our transfer centers and our transfer centers and our centralized care coordination are part of this model. And with this, we support our shared services care model, where specialists or monitoring teams can cover multiple facilities at once. And some of those examples are a centralized telemetry monitoring and wound care specialist, where you might have a wound care clinic that services, several facilities in one area. And that central monitoring, it allows us to kind of cluster the techs that monitor those rhythms without having to have someone dedicated at the facility, where they might only have, a handful, and it can spread the burden of, say, a larger facility with some of the smaller ones. And Banyan is the platform through which all of this communication flows. Again, giving that seamless model, and that we are all part of the same team. You don't feel that distance.
So that the cloud basis really is important to you being able to support these services at a distance, and be able to use those services in a very efficient manner, and at the same time have those clinicians at a distance feel like they're on site and part of the care team.
That's exactly it. And that's the experience we want our folks to have, especially with caring for our patients. It allows us to provide that care, that standard of care that we want to give them.
Are there other innovations that are coming down the pike that you're interested in?
Absolutely. So another one is channels. So with that, we are partnering with Mobile Heartbeat on the development and implementation of channels. So what are channels? Channels are persistent and always on space in Banyan for teams to collaborate and to solve team, patient, or even the logistical related challenges. So unlike broadcasts today, which are a one-way communication, so it's one person blasting to many, or group chats, which currently expire either after shift because folks have changed. Channels remain visible and searchable across the shifts. So what that does is it keeps that communication history. So any new team members, whether it be a PT, a case manager, a new RT picking up the patient, they can all quickly catch up on what has transpired throughout that patient's care. It reduces the need to scroll through long text threads, and it supports that continuity across our shifts. So days and nights, the conversations persist and remain searchable.
So for something like discharge planning, I can see what the conversation's been. If I'm new to the channel, I can see what the conversation's been, and I can see where items that need to be completed stand or what the barriers might be, as an example.
Absolutely. And another good example is talking about that discharge planning. Case managers can put in there whether the DME has been ordered. DME is durable medical equipment. And they can also, then the nurses can say whether it's been received or not. But, they can also anticipate when that medical equipment might be delivered.
So it makes it easy for people to see the status of things without having to go searching through lots of text threads.
Exactly. Or having to reach out to the case manager because they weren't part of that group chat.
Got it. Alex, what are you looking forward to as an innovation?
Yeah, so I'm excited about AI. I know that's a big hot topic in the technology world today. So I'll just highlight a couple of the ways that we're looking to leverage AI with Banyan. So we're looking to implement and work towards AI agent within the platform. And what we're trying to do here is really provide quick answers by querying data directly within Banyan. So when we talk about all these key integrations and funneling all that data into one place, this really is going to make it easy for our clinicians to have access to all of the data that we have kind of seamlessly integrated in the background. So some example use cases just to bring this home is being able to see quick insights into the volume of beds or observation patients, seeing the status of our patient alarms. So we talked about nurse call, things like bed exit, as well as other examples like heart rate or other vitals. And then lastly, really being able to quickly locate where critical equipment like IV pumps are located via something like an RTLS integration. So again, this just really removes the need to log into multiple apps to get that information because it's going to be surfaced in one place, reducing some of the precious time on behalf of our clinical staff where in prior years we might have had to look within apps to see where these things are, get that information to make decisions. And while this is really kind of high level roadmap stage, I really see this as a key differentiator for our future workflows. And we have really endless potential for what we could surface to our clinicians via the AI agents. Another piece.
Yeah, go ahead, please.
Just to kind of carry on with that is really what we are looking at doing is responsible AI to make information finding become effortless. So again, instead of digging through multiple systems, you can just ask quick and simple questions to surface the information instantly. So responsible AI, I feel like, is really going to allow us to put the key operational details right in front of our clinicians within Banyan. So again, we're really driving home that anchor platform. And this is really going to help our teams just move faster, make smarter decisions, and focus more time on caring for our patients instead of trying to do that data gathering. And back to operational workflows, this really takes a complex and really vast landscape of information gathering, and it can be applied to anything. We've talked a lot about how that could impact our clinicians with the examples that I've shared, but we really have endless potential, whether it's again, pulling information from the EHR or even helping a transport team member locate a wheelchair to move our patients throughout the facility. This technology is really designed to let us work simpler and really reduce the need for having to go hunt for information. So I think that we have a lot of potential with AI, whether it's chatbots or data summarization.
So, the mantra of health IT and informatics professionals is putting the right information at the right time, in the right situation about the right patient. And you've really built up a platform that's integrated enough key systems and enough power to be able to really start to fulfill that desire.
Absolutely. And I think we've had a lot of feedback around the number of apps as the technology landscape grows. There's only more that are being created. So we're able to do these key integrations and eventually use AI to surface that without having to port from one app to the next. So we're super excited about how the efficiencies we're going to gain.
So it looks like you can do it either through a typing in a command or voice control looks like it might be on the horizon. What have you heard about that?
Yeah, so one of the things that we're working with Mobile Heartbeat is the innovative voice controls is what we'll call it. And what that does is the goal is to enable hands-free communication. And what we mean by that is being able to use key phrases like call Catherine Walker mobile. This will enable the clinician to place that call, whether it be for assistance or additional supplies, while they are in a situation like a bedside procedure, or they're all gowned up, or they're in a sterile environment, without having to take their hands away from the task they're performing. Because if they're in a from the clinical perspective, if they're gowned up and sterile, they can't really touch a phone to make that phone call without having to redon new sterile supplies. And so it's also particularly valuable in that fast-paced and hands-free because of that busy clinical environment as well. And so we know that Mobile Heartbeat is planning to expand functionality to support additional use cases other than what we've just talked about with hands-free.
And another key piece of information that everybody needs to know is who's on call when.
Exactly.
So where are you guys with scheduling system integrations?
Yeah, so the last innovation I'd like to highlight is around scheduling. So I think a key challenge we're trying to mitigate is helping our care teams really know which physician is on duty and covering which patients in real time. We talked a lot about the directory and having a really robust care team list of who's taking care of the patients, but that is a little more tricky with the number of providers that are often overseeing a patient. So future integration is going to allow us to really display the physicians on duty, which patients are covering, and who is actually in the building. So this not only eliminates the need to check different scheduling systems, but it really, I think, enhances Banyan's role as that anchor app for care team coordination. The other members of the care team, such as our nurses or our techs, are going to know exactly which physician to contact at the right time.
Well, I really congratulate both of you and the teams you represent at HCA for making such an robust system so useful to so many people. And with that, we'll bring our presentation to a close and ask whether we have any questions from the audience.
Well, thank you to our speakers for a wonderful presentation. And I want to remind our audience that you can keep submitting your questions in the Q&A window to the right of the media player. We have some questions already, so here's our first one. This one is for Chris. Given that you have hundreds of thousands of users and 33 plus integrations, you spoke to the need for having both standardization, governance, and processes for managing all of that. How do your users feel about having a standard process, no matter where they are in the hospital or what facility they're working in? Do they view that as a constraint or as a benefit?
Yeah, that's a great question. So I'll answer from the clinical side of things. And so it's seen as a benefit by our users. And that's because by having that standardization, it allows those that travel to multiple facilities. Alex had mentioned our travelers earlier. Then we also have contract nurses that do, a 13-week stint, and they are not always at the same facility. when they renew their contract. They might go to another one. So that helps them to know, and it, or I should say, enables them to instinctively know what those alerts indicate, what, how the system works. They don't have to learn something new. It again, Banyan being that anchor application provides that seamlessly. They know where to go to find education and reference materials. It's all in there because of that standardization. And with our governance process, it allows us to, um, you know, make sure we're providing that standardization as well. And then I don't know if Alex, you want to add something on the technical side to that?
Yeah, I think from my perspective, standardization just makes everything easier to manage. If we know how the system should behave, we can really troubleshoot easily, identify root cause of technical issues we might experience very quickly. So I think when you look at that resiliency and uptime, we really have efficiencies when things are standardized across the platform. And it's also really easy to implement when we have these standardized tools and project plans and education. The programming and the build of the system from the ground up is more streamlined when we have standards that everyone is aligned with. And I think overall, everyone just has the same expectations of the system, really regardless of whether you work within the organization, whether it is in our field teams, IT teams, or clinicians, of really how the system should look, feel, sound, behave, and be managed.
Fantastic. And here's our next question. What emerging technologies will clinical communication impact the most? AI, ambient documentation, or virtual care?
So I really think that Banyan just lays the foundation for us to be innovative. On the technology side, I'm really excited. I mentioned the API capabilities and also just the ability to quickly and easily be innovative and deliver new features. I think these are all great examples, but the healthcare technology ecosystem, it's like we hear of something new and exciting every day, such as virtual care, AI. I really think they will all play a part in this platform. And I feel that the efficiencies with the cloud-based application, API, et cetera, really allows us to continue to deliver that seamless experience through inter-app launches, surfacing data, chatbots, whatever it is, we can really bring that into our platform and really meet the needs of our clinicians.
Terrific. And Chris, anything to add to that?
So yeah, I'd love to add to that. So let's look at virtual care. So virtual care, with that innovation that we can do with them, is it makes them seem like they are part of the care team. So we can dedicate that person to concentrate on the patient's intake, ask questions, follow-up questions, and then they can relay anything to the bedside, that primary nurse that's caring for that patient, to say, hey, this is what I got from there. Here's some follow-up questions. And they can also participate in reaching out to folks as well, because we have that seamless communication anchor platform that we, all know and have said is Banyan.
Excellent. Let's have time for one more question. How do you balance innovation with clinician burnout and change fatigue when you're introducing new digital tools?
Yeah, I'd love to answer that one as well. So, as part of that governance process, we evaluate every request to ensure that it's not adding to our end users' burden. And part of that evaluation, asks the questions. What is the problem we're trying to solve? What is the solution that's being proposed? Does it meet our standardization that we've already set? And is there evidence to support the requests that they've submitted? We evaluate all of those things, and of course, there's a technology piece to that as well. But we then partner with all those teams involved, with the solution as well as any potentially impacted stakeholders, to get everyone's voice and buy-in on, is this the right solution to implement for the problem that has been presented? Because we are very cautious in adding new things just to add new things. We want to make sure we're doing right for our end users so that way they can continue to care for our patients.
Excellent. Alex, anything to add to that?
Yeah, so I think when I think of burnout and change fatigue, really we work really hard to ensure that our deployment efforts are catered around our major enterprise initiative to reduce the change fatigue on behalf of the sites. In addition to that, we plan software releases significantly ahead of time to make sure all really well prepared with education, communication collateral, and we've really begun to leverage our change management practitioners here at HCA, which do a great job of helping us to distill not only the overall platform education, but new features into bite-sized consumable documentation that doesn't really inundate our end users, and they really get the information that they need to be successful when we do updates and things like that. And I think just to sum up how I feel about Banyan, I really feel that it is a platform that can grow with HCA Healthcare as the care team and technology landscape evolves over the next 5-10 years and beyond. So I'm super excited about Banyan and the possibilities we have with this platform.
And I'd like to also echo what Alex says about Banyan. I have loved being part of this journey. I'm going to love continuing to be part of this journey with Mobile Heartbeat and Banyan. They are such great partners in this initiative with us.
Great. At this time, we do have to wrap up. Thanks again, Dr. Garber, and our speakers for all of your insights.
And thank you to you for hosting us.
And once again, we also want to thank our sponsor, Mobile Heartbeat, for their support of this webinar. For our audience, don't forget to take our brief evaluation at the end of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to re-watch the on-demand recording of today's session, and it'll be available in the HIMSS Resource Hub for a limited time, so feel free to come back and watch at any time. Thanks, everyone, and have a terrific rest of your day.